Welcome back. Today with me I have Dr. Linda Chan, and she is the Medical Director of Radiation Oncology at Memorial Care Cancer Institute at Saddleback Medical Center. And we've been talking a little bit about breast cancer and some of the treatments with many others on our show, but today we're going to specifically talk about radiation. Welcome.
Thank you for having me.
You're welcome, and thanks for being with us. So we do talk a lot about breast cancer, as I mentioned, and today is a very, or actually October is a very important month.
Yes,
Tell me about it.
the whole month.
Okay.
So October is Breast Cancer Awareness Month, and so we really just try to educate women about breast health in general and breast cancer specifically.
Okay, okay. And there are lots of different treatments, and you're in charge of the radiation oncology. Tell me a little bit about what you do.
Sure. So if a woman were to unfortunately be diagnosed for breast cancer, there are three main treatments that are offered. So sometimes women could have surgery, either a lumpectomy, which means just the mass is removed plus a little margin around it.
Okay.
Or they might have a mastectomy, which means that the entire breast is removed.
Okay.
So that's one option, surgery. Second option is chemotherapy,
Right.
which, as you know, is usually some type of drug that is delivered either through the blood or as a pill to try to kill the tumor cells. But I do the third type of treatment, and that's radiation therapy.
Okay, all right.
Now radiation, most people don't know what radiation is. Radiation is essentially high energy beams, often X-rays,
Okay.
that come in like a laser. So very precise, pinpoint focused, just to the area where the tumor is located or to the areas that we're concerned the tumor might travel to.
Okay.
So it's non-invasive, it is painless, you can't even tell anything is happening. So most patients, women especially, tell me this is the easiest treatment of all of the different breast cancer treatments.
Right.
Because they essentially come in, lie down on a table for a few minutes, table moves around you, you don't feel anything, no pain, nothing invasive, and then they're done.
At what point would you choose radiation versus any of the other treatments?
So that's a great question. So that's where the devil's in the details. So it really depends on the size of the tumor, whether the tumor has spread to lymph nodes in the armpit
Okay.
or the shoulder, or God forbid spread elsewhere in the body. So usually we make the decision for what type of treatment to offer based on all of these factors. I generally like to do it in what I call a multidisciplinary setting. So one thing that Saddleback offers, which I think is so fantastic and so unique, is something called a multidisciplinary tumor board.
Okay.
And that's where all the breast surgeons, all the breast chemotherapy doctors, the radiologists that read mammograms, the pathologists that look at the surgical specimens, and the radiation oncologists, we all gather in a room and we go over every newly diagnosed breast cancer patient. So we all see all of the different aspects of their workup, and then as a team, together we decide which treatment would be the appropriate one to offer to the patient.
Okay. Okay. Well, that's good to have everybody in one room
Yes.
helping to decide, right?
Yes, it's essentially like getting 30-second opinions
Oh,
all
yeah.
at the same time.
Now you said you told us what the radiation therapy is. Is there any after effects?
Yes, so there can be. There's two common side effects for radiation. The actual delivery of radiation is very easy, like I
Right.
suggested,
Right.
but the two common side effects, one of them is feeling tired. There's often a temporary fatigue that occurs from radiation. It is temporary, it dissipates, it goes away after about a month, but I do tell women they'll feel maybe a little bit sluggish, almost like you might want to hit the snooze button in the morning. You feel like you need a little bit more rest. You might have that persistent feeling throughout and after the radiation for a short period of time.
Okay.
And the second common side effect, which I think women are usually more fearful of, is the ones related to the skin and the tissue of the breast itself.
Okay. Okay.
So sometimes women might develop pinkness to the skin, darkening of the skin like a tan, or there may be irritation. At the worst, we might form what looks almost like a sunburn with blisters.
Okay.
But I concoct a customized regimen of medicated lotions and creams to help women, because every woman's skin also reacts differently.
Right. Right. Now, if you have breast cancer on the left-hand side, and then you do have to have radiation, I think concerns might be your heart. What are some things that you would recommend if that was the case?
Oh, I'm glad you asked that question. So there is one thing in particular that Saddleback offers that none of our local centers offer, which I am so proud to talk about. So it's something called deep inspiration breath hold. It's a mouthful, but what it essentially means, I'll demonstrate on myself. During the 2 minutes or 5 minutes you receive radiation, the woman's body's still moving because she's breathing.
Right.
So the breasts are moving up and down. But if you take a deep breath in, you can see the breasts generally move up and out.
Okay.
If I had x-ray vision, I don't, but my computer system does. When the breasts move up and out, the heart and lung fall down and back.
Oh.
So we take advantage of that. So when a woman takes that deep breath in and the breast moves this way and the heart and lung fall away from the breast, that's when we turn the radiation beam on.
Oh.
So we allow your own body to physically separate the normal tissue, such as the heart, away from the target, which is the breast cancer.
Oh, okay.
And then when you exhale, we turn the beam off.
Okay. Wow.
It's very nice.
Well, that's a really smart way to do it, because I would imagine people, I mean, we're worried about going through, TSA's checkpoint with radiation and things, because we think it's a lot. But this is nice that it's just, pinpointed, like you said.
Yes, it's pinpoint, very focused. We can get down to less than a fraction of a millimeter in accuracy.
Oh, wow.
Yes.
So, perfect. What would a patient come to expect at Memorial Care Cancer Institute if they're diagnosed?
So I think they would experience two great things. One is that team approach I talked about earlier. They would understand that the entire medical team, not just the doctors, but I mean, of course, the surgeon, the chemo doctor, the radiation oncologist, we work as a team, but then we also function as a team with our nurse practitioners, our nurses, we have physical therapists, we have nutritionists on staff, we have social workers that help address transportation questions or financial questions. So we really work as a team to address the person, not just their breast cancer, but them as a whole. I think that's one thing. But I think the second and honestly much more important thing is that we really try to show people that we care. I mean, in my own clinic, I try to treat all of my patients like they're members of my own family. And unfortunately, breast cancer has touched my family. So this is very personal to me. So I really want everyone to feel when they come into our center that they are coming to my home, that we're going to do everything we can to help them, and that we care what is happening and we care about them as a whole person, not just treating their diagnosis.
Now, you said that it touched your family, and often I talk to doctors and people in the medical field who say the same thing, is that they went into this field because of that. Is that the same case for you?
Yeah, I think I didn't always know I wanted to be a doctor, but I always was drawn to oncology. But I think, unfortunately, there have been several members of my family who have been diagnosed with cancer. There's breast cancer in my family, prostate cancer, lung cancer. And so I honestly don't know what it means to sit in the patient's chair, but I do know what it means to sit in the chair next to. And to feel scared and overwhelmed, to not understand what the doctor and the different medical professionals are saying, and just to be very fearful of what's happening. So I think this is my very small way of trying to give back.
Well, that's great, and it's nice to know that there are people who can understand, even if it's not necessarily the patient, but obviously the person who is the support group for the patient. So, perfect. Well, thank you so much. It was very nice to meet you.
Well, thank you so much for having me. I enjoyed it.
All right, thank you.
Thank you.
And remember, if you also want more information, you can go to memorialcare.org/SB Cancer. We'll be right back after this.